Hey there, how's everyone? So today we're going to be talking about the posterior neural tube defects. We talked about the anterior neural tube defects the last lecture. This lecture we're going to be talking about the posterior. As we talked before, the posterior neural tube provides us with the spine. So a defect in the posterior neural tube will provide us with a problem in the spine called the spina bifida. Okay. So the spina bifida is basically classified into spina bifida occulta. Occulta comes from hidden, and we'll know why it's called that. And spina bifida aperta. The spina bifida aperta has three types: meningocele, meningomyelocele, and myeloschisis. Okay. So this basically is our vertebral body. Okay. This is the anterior portion of the vertebra, and this is the posterior portion of the vertebra, and this is the vertebral foramen through which the spinal cord passes, okay? So this here is the spinous process, this is the transverse process, and this is the lamina, and this arch right here is called the vertebral arch, okay? This is the normal vertebrae, and then we have the first type of the spina bifida, which is the spina bifida occulta. What happens here is basically this vertebral arch does not fuse well, okay? So there is a problem in the fusion of the vertebral arch, but we have an intact neural tube. There's no problems whatsoever in the neural tube. This is called the spina bifida occulta, okay? The patient may present with a skin dimple or a tuft of hair. Then we have the meningocele. The meningocele is like the spina bifida occulta. There's a problem in the vertebral arch, but this time we have a herniation of part of the spinal cord, basically the meninges of the spinal cord. The meninges, as we will learn later, are the outer coverings of the brain and the spinal cord. There are basically three layers, and we're going to be talking about them later in more detail. So the meningocele is like the spina bifida occulta, but this time we have herniation of the meninges, okay? And then the myelomeningocele is exactly like the meningocele, but we have herniation of the meninges as well as the spinal cord. And then we have a more severe type of the myelomeningocele. It's rarer, it's more rare, but it's the most severe type. It's basically the same as the myelomeningocele, but without the skin. So there's a skin opening, and the spinal cord is basically out in the air, and this can cause a lot of troubles. This is called the Myeloschisis or Rachis. Okay, so the first spina bifida, the spina bifida occulta, like we said, is a problem in the formation of the fusion of the vertebral arch. There's no other abnormalities, no problems in the neural tube. So the alpha-fetoprotein is normal, okay? It's called occulta, right? Why is it called occulta? Because it can be missed with the prenatal ultrasound. We don't see anything with the prenatal ultrasound. It's common in the lumbar and sacral vertebrae. Then we have the first type of the spina bifida aperta, which is the meningocele. As we can see here, we have this large cyst that's lined with meninges and containing CSF. And as we can see here in the ultrasound, this is the spine and this is the cyst, the meningocele. This is a neural tube defect, so we're going to have an elevated alpha-fetoprotein. The meningomyelocele is exactly like the meningocele, except this time we have the spinal cord herniated as well. This can present earlier and is obviously more severe than the meningocele, and the patient might present with lower limb weakness or sensory loss due to the spinal cord herniation. And as we can remember from the previous lectures, we said that the Arnold-Chiari type 2 is associated with a type of spina bifida, a type of a posterior neural tube defect called the meningomyelocele. So remember that the Arnold-Chiari type 2 is associated with meningomyelocele, and this is a neural tube defect as well, so it's going to have elevated alpha-fetoprotein on amniocentesis. And finally, the most severe type, even though it's the most rare type, is the Myeloschisis or Rachis. Schisis means an opening. We have a dermal opening here, and the spinal cord is basically protruding out of the skin into the air. This is the most dangerous type, and this is a neural tube defect, so we're going to have an elevated alpha-fetoprotein. Now let's talk a little bit about the 3 primary vesicles that we mentioned in the last lecture. We basically said that there are 3 primary vesicles from which the brain develops. There are the forebrain, midbrain, and hindbrain. They have other names. The forebrain is called the prosencephalon, the midbrain is the mesencephalon, and the hindbrain is the rhombencephalon. Those 3 primary vesicles then develop into secondary vesicles, 5 secondary vesicles. And those 5 secondary vesicles provide us with our brain, okay? So the forebrain develops into telencephalon and diencephalon. The midbrain develops into mesencephalon. The hindbrain develops into metencephalon, myelencephalon. So to memorize their order from top to bottom, remember that the telencephalon is the first one. The diencephalon, we have a di here. Di comes from 2, so that's the second one. And then this one and this one and this one, we can arrange them according to alphabetical order. So mesencephalon, S, and then the T, metencephalon, and then the Y, the last one, myelencephalon. All right, so each one of those 5 secondary vesicles has a cavity and a wall. The wall provides us with something, and the cavity provides us with something. So the cavities basically provide us with the ventricular system through which the CSF gets drained. So this first one here, the telencephalon cavity, provides us with the lateral ventricles. And then after the lateral ventricles, like we said in the previous lecture, we have the third ventricle. So the diencephalon provides us with the third ventricle. And then the mesencephalon provides us with the cerebral aqueduct that connects the third ventricle with the fourth ventricle. And then this last portion here provides us with the fourth ventricle. The upper portion, which is the metencephalon, provides us with the upper part of the fourth ventricle. The lower portion, which is the myelencephalon, provides us with the lower part of the fourth ventricle. So that's all that's all we have to talk about when it comes to the cavities. Now let's talk about the walls. The walls, first of all, the telencephalon, as you can see, we have those 2 bulges. So the telencephalon, as you can see, provides us with the cerebral hemispheres and also provides us with the basal ganglia, which we will talk about in another video. So the telencephalon provides us with the cerebral hemispheres and the basal ganglia. The wall of the diencephalon provides us with the thalamus, the hypothalamus, and the retina, and we're going to be talking about those in later videos. The mesencephalon provides us with the brain, and then the metencephalon provides us with the pons and cerebellum, and the myelencephalon provides us with the medulla.